Okay, standard precautions are in place for both rescuers. As soon as you find that your patient is bleeding, we're going to apply direct pressure to the wound. In many instances, direct pressure is all that's needed to control the bleeding. If not, then we simply go straight to the application of a tourniquet. Now, when we're applying a tourniquet, we're going to take a triangular bandage. We want to fold it into a nice wide width. We're going to wrap the curlix around the extremity proximal to the wound at least 2 times. And we're then going to tie the triangular bandage into a square knot laterally. We then take either a piece of wood or a piece of metal, which is called a Spanish windlass. The Spanish windlass is then going to be placed underneath the triangular bandage and twisted. And we twist this until either the bleeding stops or you lose the patient's distal pulse. Once the bleeding is controlled, we're going to stabilize by simply tying with the tails of the triangular bandage. Another version of the tourniquet is a commercially prepared model, and these typically use Velcro, and it's even easier to apply than using a cravat. So we're simply going to take the commercial product, apply it proximal to the wound, snug it down as best we can. We're then simply going to twist the windlass until the patient loses a distal pulse or the bleeding is controlled. Hold it in place and the bleeding is controlled. Once the bleeding is controlled, we can then go ahead and curlix the dressing in place for patient transport. If your patient has signs and symptoms of hypoperfusion, we're going to apply high flow oxygen to the patient, keep the patient warm by using blankets. We're going to position the patient appropriately, and we're most importantly going to immediately transport the patient.